Next, we're going to be doing the Lachman test. It's also known as the Ritchie test, the Lachman-Trellat test, or just the Trellat test. It's testing the ACL, the integrity of the ACL. What we're going to do is have the patient at 20-30 degrees relax. What we're going to do is stabilize the anterolateral region of the thigh to stabilize the femur. We're going to place our other hand on the just below the tibia, right behind the proximal portion of the tibia, and we're going to add a posterior to anterior translation of the tibia on the femur. That's what we're looking for, or a soft or absent end feel. So what we're going to do is go ahead and begin the test. So I see that there's no translation. I'm going to go ahead and test the other side. Again, stabilizing the distal knee and the proximal thigh or tibia. And we're pulling forward. Compensation for this test would be tight hamstrings, or if the patient's not relaxed, as well as an already torn PCL, which would give you a false positive in that anterior translation. Next, we're going to be doing the Wilson test. There's no other names for the Wilson test. What we're testing is the lateral condyle. What we're going to do is go ahead and have the patient seated off the end of the table. We're going to have them kick their leg out. Good. Down. No pain with that?
No pain.
Okay, then we're going to have them externally rotate and kick out. If there's no pain, you wouldn't have them externally rotate, but for this, we're going to go ahead and show that. On the other side, we're going to have them kick out again. Good. Now externally rotate. And good. What we're looking for are compensations, like lifting the leg off the table. Tight hamstrings would be a compensation of this test, or improper rotation throughout. Again, we're looking, a positive finding would be if they have pain with knee extension, and then it subsides with external rotation and knee extension. Next, we're going to be doing the posterior drawer test. With this test, we're looking at the PCL. What we're going to do is have our patient lay supine with their knees bent to 90 degrees, about 45 degrees at the hip, with their legs flat on the table. What we're going to do is sit on their foot. We're going to grab the thigh or the proximal tibia, placing our hands on either side of that tibial tube, our thumbs on either side of the tibial tuberosity, right below the knee. And we're going to add a anterior to posterior force. What we're checking for is the anterior to posterior translation of the tibia on the fibula, or on the femur. We're going to go ahead and do the other side. Sit down on it, take our hands, and we're pushing backward. Some compensations would be a tight quadricep, pulling the femur or the tibia forward, and that's the posterior drawer test.